So thank you everyone for joining us. Thank you to the advisory group members who are here. It's much appreciated. I think I know all of you. I'm Melissa Jardine and I'm moderating. Unfortunately, Nick couldn't make it today. He sends his regards, but so we can also record it so he can catch up with what has happened. So just some housekeeping to start. Just please keep your microphones on mute unless you're speaking. That's down there in the bottom left. And also please feel free to use the chat box throughout to add any questions or examples of case studies that you think would be useful for us to follow up while I'm speaking. Yes, so I'm Melissa Jardine, if I haven't met you yet, and Munya will be presenting his research today. And just for a little brief overview for those of you who may not be aware, but this project, Envisaging the Future, was initiated after the murder of George Floyd in the US, and it's funded by the Open Society Foundation. And we wanted to look for, after the murder of George Floyd, we wanted to look for public health approaches or non-policing approaches to public health problems or problems that have traditionally been criminalised or responded to by police. So what Munya has undertaken is a look at some programs in Africa to look for different ways of doing things. And we have the project that covers 6 regions, and we'll be having 6 consultations like this this month. And this is the second one that we will have had so far. So just a brief agenda. Munya will give a brief overview. We have circulated a report to you in the email. And after that, we'll open it up for questions to Munya or other commentary about where you think we could go with this research, what contribution it can make. We have until February 2022 to finalise the project. I note that there's already been some excellent discussion in the email thread about the role of politics within the police institution or high-level politics. So maybe we can recap some of that, and that can be part of the discussion too. So thank you very much for your time, and I'll hand over to Munya.
Good day, everybody. And I'm sure the majority of the people are within Southern Africa. And I'm not sure what time it is in Australia and the Netherlands, but good day to everybody. My name is Munya Katumba. As already introduced, and I was part of the team from the 6 regions that research on partnerships and collaborations globally, and I represented the Africa region. Basically, my background with the Center for Law Enforcement and Public Health was involved on this Envisaging the Future project, which documented the case studies globally, and I represented Africa. As well as also I've been working since 2020, working on building a law enforcement and public health network. And so far we have had a database where we collected some contacts that we are most likely to start the network with. With AIDS funds, also been working with Southern Africa Regional Police Chiefs Coordinating Organization, that's SAPO, based at the Harare, Peru, in developing training materials, which under the SAPCO member states, which are 16 Southern African countries, and we are at preliminary stages of documenting or developing some materials for member countries. With COC Netherlands, I've also been working with them on issues of SOGI, the sexual orientation, gender identity and expression, and also in working on developing some training material for the South African Police Service, together with some other consultants. What I will share today is basically what we documented within Africa. So the presentation will cover the situation as it relates to law enforcement and public health collaborations and partnerships that we found to exist. I'll also cover who drives or leads these law enforcement and public health collaborations. Looking at, do they work well together, and if there are challenges and problems, what are some of those challenges and problems? And then also just give an overview of some of the examples that we came across. I should also say, especially on the examples, that most of them, they are from Southern Africa, although we do have, Kenya, and Ghana, for example. But I think in the end we'll discuss some of the common themes, and if there are any across Africa that you people who are attending today still feel we should add, I think we could go ahead and add those. So in terms of the situation, we've seen that there are some partnerships and collaborations, especially when responding to epidemic or pandemics, especially as it relates to HIV and AIDS, STIs, malaria, and of recent in terms of responding to COVID-19. We've also seen some collaborations when responding to gender-based violence, especially as it relates to agenda setting, policy reviews at local or national level, and also at regional level. We've also seen some collaborations and partnerships as it relates to addressing issues of socio-economic challenges and problems, especially at national level. And one that I'll also cover is, counter-insurgents or responses to terrorism, especially when it happens within civil spaces, when law enforcement are addressing issues of rape, disease, death, or other related situations. In terms of whether the collaborations are working well, we've seen that those that have a long history or experience of working together at a national level, there is quite some good work that have been happening and are working well. Because over years, they might have developed some common goals towards local, national, and global health outcomes. Those that have not been working well, especially with civil society organizations, the challenge has been some of the strategies that they use. I'm sure back in the day, and things are still improving, that they've been, a lot of blame that have been put on law enforcement as it relates to some of the challenges that communities and society at large also experience. In some countries, we've also seen that law enforcement actually perceive some of the civil society organizations or community-based organizations as enemy of the state because of some of the, either the programs or projects, that they implement that seem to be, not in relation or in support of, norms of, those societies and so forth. Law enforcement also, in terms of some of the criminalized behaviors, especially as it relates to either sex work or homosexuality and so forth, we have seen that law enforcement mainly, they would tell the civil society that they are there, or societies alike, that they should be able to or arrest criminals. And sometimes these collaborations, they do not work well because over years of implementing projects and programs, the status quo remains, things remain the same, and therefore create a lot of conflict. In terms of who drives them, we've seen intergovernmental departments collaborating with the security sector. And one good example is from Botswana, where the security sector formed what is called the Botswana Main Sector, where they address issues that are related to the security sector, as well as also health related projects and so forth. Also, we've seen the government and law enforcement as it relates to the multi-sectoral HIV and AIDS, STIs response, mainly that have been used to implement the Global Fund, PEPFAR, and USAID projects and programs within mostly across Africa. We've also seen civil society organizations leading, especially as it relates to issues around human rights, key populations, and addressing violence, and also on issues around girls and women's rights to seek abortion services and so forth. At regional level, there are some regional bodies. For example, I mentioned earlier on the Southern Africa Regional Police Chiefs Coordinating Organization that is leading, especially is on health, HIV, AIDS, STIs, and developing some training programs for each 16-member countries. So here we actually see inter-country or international, inter-regional countries or member states coming together or collaborating and building partnerships to develop or respond to pandemics and health situations. SADC also have been very instrumental in terms of HIV and AIDS, also responding, for example, recently in Mozambique to terrorism insurgents within the region. Some other regional economic bodies, we've seen ECOWAS, COMESA, ECAS, also responding to insurgents, for example, in the days of Lord Resistance Army in Uganda, as well as also Sierra Leone, Boko Haram in Nigeria, and El Shabaab in Somalia. So some of these have been very good collaborations and partnerships, also involving the UN family in peace building in the countries that I've mentioned. And we've also seen the UN family collaborating with either local partners as well as law enforcement in addressing policing around vulnerable groups. What have been some of the problems and challenges that we've seen? The first one would be on laws criminalizing same-sex relationships, sex work, and drug use. This has been a major challenge in that the way police, either arrest or detain some of these groups have been very detrimental either to their health-seeking behaviors or their human rights being abused and violated. We've also seen, civil society organizations and community-based organizations, and I've mentioned earlier on, perceived as working against, the state or government because of some of the projects they implement that relates either to same-sex, sex work, or drug use, thereby that are deemed as promoting immoral behaviors, or in some instances, some other countries have said, you're actually implementing the Western agenda of doing things. In some countries, we've also seen some backlashes, especially when embassies, from the global north, advocate or, put statements that support, promotion and especially promotion of human rights as it relates to key populations. We've also seen some huge challenges between, the civil society organizations as well as also law enforcement. In that civil society systems, they are more flexible as compared to law enforcement, which are more rigid, bureaucratic, protocol-driven, and length processes. thereby you'd find that most of these organizations, the partnerships wouldn't work very well because of either programs or projects that need to be reported and nothing has happened on the ground. And of course, also issues around financial and human resources has also been hinted in some instances as a challenge to having meaningful collaborations and partnerships. In areas where peace building missions are being conducted, there have been actually challenges in the use of force, which in some other parties have deemed it to be the same as engaging in war and so forth. And they would have wanted, law enforcement to be, accountable to themselves and the security sector. With some of the partnerships and collaborations that work well, we've also seen that there've been some benefits. For example, in South Africa, where which I'll share a little bit later, where there's been a program that has been developed with civil society organizations and local South African experts on sexuality, gender, human rights, drug use. We've seen that there've been some improvements in how the South African Police Service either reacts or implement or police around these either key populations or vulnerable groups. I've also seen this because there've been, increased knowledge on how to deal, for example, with issues around violence, issues around withdrawals when it relates to drug use and so forth. One also of the biggest challenges has been the civil complaints and lawsuits against law enforcement. For example, in South Africa, there's been a slight decrease, in the amount. And then also because at least police are able to deal with some cases that end up not being, wrongful arrest and so forth. I've also seen, some improved relationships with the community where the training has been implemented and so forth. And one of the big benefits has also been, linkages with some law enforcement, especially with the Dutch police, Pink and Blue, where the South African Police Service has visited and they have had some exchanges and so forth. And we've seen that this works, especially when you have some other law enforcement agencies sharing, what is worked within their constituencies and so forth. So lastly, I'll share just a little bit on some of the collaborations and partnerships that we've seen to work, and some of the examples that are actually coming up that have been researched. So the first one is an example from Durban, where police have been advocates, especially on harm reduction. Instead of being punitive, we've seen that they are actually advocating for harm reduction, especially one case study from Durban that happened during the lockdown in 2020. In Mozambique, they're implementing the gender desk in 11 provinces, where civil society organizations, community-based government departments, as well as law enforcement, they've come together to address issues around sex workers, drug use, and so forth. And we've actually seen that law enforcement are actually advocates for some of these groups, which has not been the case in the past. Also in Kenya, there were documented cases of stigma and discrimination, and we've documented one of an article that also works around issues of stigma and discrimination. Kenya, Liberia, Sierra Leone, there have also been some case studies where civil society organizations partnered with the security sector in responding to some of these issues around gender violence, sexual orientation and gender identity and expression. To just divert you also from issues around key populations, there have also been good examples of law enforcement or police working with community organizations and individuals, especially in Ghana, Nigeria, Uganda, and Zambia, where women have been finding it very difficult to seek abortion services, especially when they need to do so because it's criminalized, thereby affecting, the way they would seek health services within their countries. South Africa, like I've shared before, there is a training program that has been developed by law enforcement, the South African Police Service, as well as the local partners, and they seem to be working well together in training. As we have seen that there is a slight change in attitudes and practices of the police officer who have been trained. Zimbabwe, there was also a very good example with the Zimbabwe Republic Police, where during the COVID-19, they actually some of the medical staff within the police were deployed to general hospitals to help with providing clinical services during the COVID-19. So that's actually a very good example of partnerships that have helped, especially with providing services by the police to local communities. And then the last one is on police and peace building missions that have been happening over the past 20 years, that we've seen some international organizations like, the UN Family, as well as other, and then the local police institutions coming together to address, the rule of law, either, building a framework or developing a framework for that country, and then also helping out to develop those frameworks and implement them. All right. Thank you very much. This is what I had to share with you.
Thank you very much, Munya. And so, there's a lot you've covered, and of course, there's so much to cover that it's impossible to cover everything, but I'd like to open it up to people for questions. We have some very experienced people in our advisory group who I'd love to hear from. So I guess what we want to do is, you can ask Munya questions, but as well as we want to look at how we can advance this work. So looking at what are the themes that are important, how does change occur, and I'm just letting someone else in, and what are the things that we need to focus on going forward. So I'll open it up, and if you would like to speak, please unmute yourself. We are a relatively small group, so we should be able to manage that. Okay.
I'll kick off, Melissa, if that's okay.
Great.
I'll even show my face if anyone wants to see it. Okay, so I mean, I'm actually really impressed with that presentation. I think it's substantive. I think there's definitely shifts that are happening. I think there are two things that I think we need to bear in mind. And I'm going to say this as one of the people responsible for documenting that Durban case. We found that we still have really good relationships with the police at the local level. But I'm very conscious of how tenuous that is, given the national instructions that are still pervasive amongst the police at local level. So the police are definitely feeling this tension between protecting the clients who are accessing harm reduction services and making arrests in terms of their performance indicators. And so we constantly having to try to manage that. So what we find is that there is a protection in that particular space, but outside of that space, it's a little bit more tenuous. And I think that what that means is ongoing deliberations with police. It's easier to do it at a local level, except that the instructions come from above. And I would also probably say that in Durban, we are particularly fortunate to have the support of the Commissioner of Police, of the Metro Police on board, because without that, the sort of rank and file police officers may feel less confident in doing what they're doing with us. But I do think that, the point that you and I were debating on email the last few days, Munya, is one that we really do need to think about here. If I look at, and I'm sorry to be so South African focused, but I don't want to assume anything about other African countries that I'm not in currently. But I have seen how tenuous almost every learning that the police have, whether it's around public order, whether it's around policing vulnerable population groupings, whether it's about use of force, all of those things, and I'm sure Andrew will back me up on this, is incredibly tenuous and is very, very dependent on political and social circumstances. And so we really, really do need to contextualize, and this is where sociology is so useful. We really do need to contextualize where these things are happening and why. And I think if we do that across the various countries, it may help us in coming up with a sort of more analytical approach to, for example, why is it that in certain African countries, it's easier to engage with the police, whether with or without political support doesn't really matter. What is the context that allows that to happen? So I think, in terms of maybe the next step of analysis, that would really be where I would think we should be going. I'll leave it at that for now.
Okay, there's Andrew has his hand up. We'll go to you, Andrew. Thanks.
Thanks. Hi, Melissa. Nice to meet you, quote unquote, after chatting. Hi, Munya. Nice to see you. Hi, Monique, and everybody else. Greetings. Yeah, thanks, Munya. That was great. I thought you were kinder to the South African Police Service than some people would be in terms of the success of programs. But I totally hear what you're saying, and it's what Monique is also saying, is that these things work with the people you're engaging with, but then once you withdraw and leave it up to the organization to sustain, politics and power and competing priorities can get in the way. But that's not what I was going to say. What I wanted to say was a couple of things. So just in terms of what Monique just said and me trying to be optimistic, as we know, there's huge attention on the security cluster in South Africa, and apologies, I'm also going to talk about South Africa. But there's the potential for some reforms coming up, I think, and they're not very visible to most of us at the moment, but I think there are conversations happening at high levels, which might help to untangle some of this very hierarchical organization that we have, and the problem that there's this national performance system which continually pulls frontline police officials who might be invested in one or other alternative view. So we can be hopeful there. But what I wanted to say was, I'm not sure if you're aware, Munya, I know some others may know some, but there's quite a lot of growing interest in South Africa about area-based violence prevention interventions, which overlaps a lot with some of this, and in the Western Cape in particular. Some of those conversations happen without consideration of law enforcement, but in the Western Cape in particular, the Western Cape Safety Plan is envisaged as a plan that intentionally brings together law enforcement personnel and a broader basket of public services that would fall into the violence prevention arena. And so it's really exciting. It's been kind of on paper for 2 years, and there are lots of motivated people working on it. But this comes back to the question about the challenges involved in this work. And in the South African context, it's that you've got policing mostly at a national level, and then you've got Metro Police, of course, and then you've got provincial departments of social development, provincial departments of health, provincial education, you've got city enforcement. And so a lot of the challenges we're seeing here is you've got a great vision, you've got stakeholders who want to buy in, but we've got a governance structure which makes it difficult to actualize. And there's definitely movement happening. So it's just something I think we should all keep our eye on, both in terms of trying to help move forward, but also to try to learn lessons. And linked to that, the other note I made was the Western Cape government has also adopted this Harvard Kennedy School problem-driven iterative adaptation problem-solving kind of process. And I was on the safety team for that, which is also an attempt to bring different government bodies together. So we've got the prosecuting authority, the SAPS, local police, Department of Social Development, etc. And we've got to try to solve the problem. Repeat violent offenders are routinely arrested but never convicted and kept behind bars. And so there's a frontline criminal justice element, but there's a back end social development intervention in terms of youth intervention and the like. And unfortunately, that has also fallen apart because of this challenge of getting the different spheres of government to work together, and just the practicality of life. So I think there's a main obstacle in much of this is how we've structured governance and where the funding lies. And it's not a solution, but I think it's something we can work around. We just need to actively work towards creating the mechanisms to help these different groups work together because they want to. Thanks.
Great, thanks, Andrew. And I think we're about to upload that information about the Western Cape on the GLEFA website soon. So thanks, we can share that with everyone. Is there anyone else that would like to ask a question or make a comment? Would anyone like to comment on some variation? We've heard about South Africa and Southern Africa. Anyone else? No. Well, I think Alki had something to share since I was talking to him earlier today. Alki?
Hi, Melissa. Hi, everybody. I'm actually trying to solve a computer issue here, so I'm on my phone now. I hope this works, and I'm starting up my other computer at the moment. But I'll try and do it like this. No, I really like the research, obviously, and it's very interesting, and it's really good that we're doing this. So wonderful. At the same time, I thought, well, what is sort of missing is where it's not about examples that are sort of changing the conversation. So from my perspective, and I don't mean this to be how do you say, unpolite, but it looks very traditional in the sense that we are basically looking at police dealings with vulnerable populations, and for me, what I'm looking for is how we can actually change the conversation around law enforcement and public health by making law enforcement aware that they are public health interventionists, and the other way around, making public health aware that actually police, next to being really bad for your health, as the examples show, can be an important ally in achieving common goals of community well-being and safety, if that makes sense at all. So if I try to, I'm trying to broaden a bit what we're looking at, and come up maybe with new models around community safety and well-being, sort of superseding the issue around police as law enforcement and all the problems that are related to that. I'd like to comment about the, for example, the Western Cape. I've been very active there many years ago with Clifford Shearing and indeed with the Metropolitan Police, much more than with the SAPS. But this was also about, trying to change sort of the outlook, what the role of policing and other actors is, as it is related to community safety and well-being. And so this takes you a bit away from the specific organizations and whether they're cooperating or not, which is a very important issue, obviously. But tuning in with what Monique said, by trying to reach a next conceptual level, I was thinking along these lines. I hope I made myself sort of clear. Sorry.
Okay, so you're talking about changing the conversation, changing the way that people conceive of the relationship between policing and public health. Oh, okay.
Well, yeah, to get back to Melissa, to where this movement started, that on many issues in public health, and many actors were saying, well, actually the police is really bad for your health. They are really, sort of frustrating what we're trying to do. And then the starting point was, all right, but what happens if we try to actually speak to them and change their outlook? So that is sort of the starting point for me also, about thinking about law enforcement and public health, sort of redefining what we're at, and not taking the separate organizations, leaving them sort of reforming them, for example, on specific procedures, but trying to come up with a new perspective. Yes.
Mm-hmm. Okay, Munya, is this having any, developing any thoughts or responses with all of these insights?
Yes, I think I will start on what Monique commented about earlier, that sometimes, also it's a carryover from the discussion that we had on email, as it relates to, addressing issues around, politics, and, some of the comments that come in is, I'm hearing some echoes.
Alki, so now you're on to...
Okay. I can go ahead.
Yeah.
Hello? Can you hear me?
Go ahead, Munya, it's fixed. Yeah, we can hear you.
Okay. All right. Okay, great. I want to comment on, following up on Monique, that, sometimes we focus on issues around, or operational issues, and not do much, especially on the political side, the politics within, the law enforcement or the police institutions themselves. And then also, the national politics, either of a country or a region. I would also give an example where, when I was doing this research, I spoke to a number of, police institutions, and, they were very open, and honest in saying, yes, we do want to do the right thing, but in most cases, there are issues around, political interference. And I'm sure we everyone who is in here knows that, especially, police management, they are appointed in most cases, by the executive. And this has also been a big issue, that, some, commands actually come from, the highest office for, police officers, either to implement, certain decisions and so forth. So I completely agree that I think we do need to look into, issues around, politics within the police institutions themselves, and then also broadly, how politicians behave and do things, at a national level. Andrew also commented, he was being nice with me. He says, I was being nice with South African Police Service. I think what's very important, what I've learned over the years, is to maintain, good relationships, right? Sometimes we can say quite a lot of, bad things about, how we are doing things. We have seen, especially in South Africa, that there've been a lot of, fighting and antagonism, with the police themselves, that in major and in most communities, they are always complaining about, the South African police services conduct and their actions. And what I've learned is, building good relationships, trusting, good relationships, honest relationship with the police actually helps in the long term in making sure that, you start to, develop certain programs and follow up on those programs to ensure that, there is change. That's why I shared earlier on in that, in most cases, we've also learned that they are very rigid, they're very bureaucratic. So things actually take quite some time for them to work and so forth. So that's what I also wanted to comment on that. And then in the chat box, Donna has also shared some other examples like what APCOF, University of Pretoria, and AMSHA we're implementing as it regards to training, police officers on vulnerable groups and so forth, or policing around vulnerable groups. And then also one good example, I saw Sean Tate is also attending on petty offenses. I think APCOF has also done quite considerable work with law enforcement and policymakers, across Africa. That these are some of the examples that can also be documented. When we started the program, I also shared quite a bit on my bias, that, the area that I'm working in is around vulnerable groups, key populations and so forth. So that's why you also see that some of the examples have been coming from, vulnerable groups and key populations. But we need, especially from the group or from across Africa, some examples that are happening, some good things that are also happening, or even examples of some collaborations that are not working so well, because we could get, some very good lessons from why they are not working well, and so forth. But also, lastly, I want to emphasize that, building good relationships with the law enforcement pays in the long run.
Thanks, Munya. I'll note that Monique has said that she would speak in a minute. I'll just go to Donna first. I think she may have some internet blackout issues, but hopefully she can speak. Are you there, Donna?
Yes, can you hear me?
Yes. You've gone on mute again. You need to unmute again. Yep.
Okay, sorry. I guess I was looking at things from a little bit of a different perspective along the APCOF lines with the Decrim of Petty Offences campaign. But are there any capacity building projects focused on civil society to actually increase their capacity to understand the policing hierarchies, the best practices for interactions and communication, and LEF approaches generally? One of the learnings from the Positive Policing Partnership initiative that we've kicked off and has sort of fell over and then is slowly being revived is that need for a funded strategic driver and training packages and seminars for civil society and communities to actually understand what law enforcement and public health approaches are, and also to help them advocate at both the policing level and also the more strategic policy level.
Did you want to add anything, Munya? You're on mute.
No, not for now.
Okay, we'll go to Monique.
Sorry, everyone. Yeah, no, I mean, I think I'm going to really pick up on Olga's comments. I think this idea of theory building is really, really important, because otherwise we end up with an aggregate of case studies, which are exactly that. And they can be quite disparate, and they can say a number of different things, and we have to make sense of it. And I did think to myself that I'm not sure if people like Andrew and others have been in any way using the Afrobarometer in terms of getting a more sort of continental understanding of a variety of issues, because we may find that within the Afrobarometer, there are questions around people's feelings of security, safety, and attitudes towards law enforcement. I'm saying this, I've recently had to, I probably shouldn't say this in case it's somebody in this forum, but I'm sure it's not. I've recently had to review a paper that looked at the relationship between homophobia and xenophobia. And the data was drawn from Afrobarometer. Now, what was interesting to me really was what the paper was trying to do is to try to develop correlations between different forms of discrimination and how they looked in this case, in 5 different African countries. The paper itself doesn't really matter, but I thought that the methodology was really interesting, because Afrobarometer does have some very useful information that if we're prepared to maybe look at some of the correlations and bring on board somebody that's much more quantitative in their orientation, which is not me, for example, we may find that we're able to come up with something that, you know, the value of quantitative data is that it often creates a sort of a frame in which we then do more qualitative stuff. And I think most of us, or many of us here, because of our leanings towards the human experience, tend to be much more qualitative in our approach to doing research. So I think it would be something to consider as an organized grouping, to bring on board somebody who is quantitative, that we can start engaging with some of the correlations and getting some kind of cross-country analytic going. And then we can use these kinds of more case study approaches to sort of untangle what comes out of a sort of a more meta-analysis. It's just a suggestion.
And so would that be when you mentioned earlier about, where is it, around that, the context, so they would be, that Afrobarometer would be adding some of the meat to that context that you would analyse. And
yeah, I think I think what it gives us, Melissa, is at least a sense of population attitudes. Yeah. You know, and attitudes, in as much as we write them off sometimes because they tend to be kind of shallow rather than deep. But I think they do give us very quick indicators around what people's response is to sort of socio-political, religious environments. Because, you know, in this paper that I'm referring to, you know, the religious context was very, very important in the analysis, you know. And I think we tend to forget all of those things in the work that we do, and yet they're very, very critical. But we're not bringing them in. So it would be, you know, maybe there needs to be a small group of us that looks through what are the Afrobarometer sort of indicators that we may be interested in, and what are the correlations that we think may be useful in terms of analytics, you know? So that would maybe be something that we can think about, definitely something to raise with somebody like Nick, as something which we could perhaps contract somebody in. As I'm saying, like, I don't know if there's anyone in this group that is comfortable with quant stuff. I'm not, but I'm sort of learning as I go along the importance of it in terms of, as I've said before, the framing data. And it may alert us to certain things that we're not picking up because we're focusing on these micro studies really that are about training experiences or about bringing cops into sensitization programs or responding to a small policy which police may have implemented in some group, or a civil society intervention. So that's the reason behind it. But I'd be curious to hear what other people think.
Andrew has his hand up, please.
Well, I just some clarity from Monique, please. So Monique, I fully agree. Afrobarometer is brilliant. And I confess that, as with most of my work, I generally just look at the South African samples, and particularly the how much do you trust the following people, and then they rank everybody. And the police are the at the bottom after opposition parties, and also how many of the following are involved in corruption. And it's interesting to compare that at the continental level, and they provide the occasional comparison. I'm just wondering if you are saying that we should be going much beyond the data that they provide in their briefs, because you're talking about somebody who does quantitative analysis. So are you suggesting we try to get the big data sets and crunch some kind of analysis that isn't already available? Because their samples are representative, but they're at the borderline for representativity of kind of the 2,000 people. So I'm just wondering if you can just be a bit clear about what you think we could do with them beyond what is provided by the papers.
Well, it's how we understand data, Andrew. This is, in many ways, it's unprocessed data. So the role is really to say, how do we take data and what is the analytical frame that we wish to impose on it, right? And that's why I'm giving the example of the correlation between homophobia and xenophobia, right? Because actually there is a very strong correlation between the two. And it is about, the underlying analytic, which is not mine, of course, is that, that generally when you try to exclude one group of people, the tendency is to try and exclude others. And then, what this group of researchers did is they went beyond that to say, okay, what are the sort of social values and the religious sort of input of these various different countries that may have fed into the kinds of homophobic and sort of xenophobic attitudes that have emerged. So the interesting thing, for example, in this study, which is of no consequence to us, is that actually the place which is least homophobic and also least xenophobic is Mozambique. Now, how these authors try to understand it is interesting, and it's got to do with various political sort of components and constitutional arrangements. It's also got to do with religious influence, which is why, for example, a place like Mozambique would probably be much more open than a place like Senegal, and so on and so forth. Now, whether their analytics are right or whether we agree with them or not is irrelevant, but I think what we need to be saying is, what are the correlations that we would be interested in examining from this raw data set, and maybe just, not just about what do you think about police, or what do you think about corruption, but maybe what do you think about government generally, or how do you relate to particular groups in the society? Because I think, we always say this as people that write about police, that these are microcosmic, sort of spaces, the police organizations. They're not separate from broader attitudinal spaces. And I just think it's something that we don't delve into enough, is dealing with big data sets. And I'm just recommending that as a group that is concerned with a continental approach, that we use the data sets that are available, and we can come up with correlations, and then we can pass it on to someone else. Unless, for example, Institute for Security Studies is interested in doing this kind of thing, which, we may then say, okay, well, let's think about this and what we'd like to commission as a group. So that's kind of what I'm thinking about. It is around big data sets.
Excellent. Great. And I see Alki has his hand up, so I'll just go straight to you in case it flows straight on.
Yeah. So I understand totally what you're saying, Monique, and I do think it's important. We all realize probably that context matters, right? And we need to look at what dimensions are important of the context as related to issues around law enforcement and public health. So apart from the big data, I think that is an important point, because otherwise we would say like our best practices we could replicate everywhere without looking at the context, which would be pretty foolish. So I think that is a really valid point. It brings me to another, sort of related point is, and one of the things Munya met as well, like police having to make so many arrests, and that gets in the way of, more productive approaches. Related to thinking about data and outcome indicators, I think it's really worthwhile if we come up with ideas of, what would be, from a law enforcement and public health perspective, interesting outcome indicators, which we could use to, say something about how things are going, beyond how are things going with the police, separate from public health, but how is law enforcement and public health generating, something we actually favor. It's just an idea.
Andrew, I can see you're adding some things in the chat. Would you like to speak? Otherwise.
Hi, well, look, I just think there's great value in quantitative data, but correlation actually from a big science perspective means very, very little, because you can have no indication of causality or direction of causality. So like just cross-sectionally, you can describe something, but you've got no idea of the pathways or the direction of influence. And there would be so many things that aren't measured in a selected number of indicators that from a public health perspective are viewed as confounders. So you can't really tease out, are you measuring the influence, or is it something else that's causing the change that you're not measuring? So it's such a broad topic. We would really have to drill down to a very, very specific question and then start identifying what would be the potential quantitative metrics that we would look at. That's just a note of caution, but I think there is a lot of value in using quantitative descriptions to contextualize the case studies. But similarly, there might be health and safety joint indicators that might be a more medium balance, that we can see how well people are doing in those contexts at whatever level the case study is. So it could be at the metropolitan level versus the national level. But it just gets so complicated when you're trying to look at a national or a sub-national picture, when all of the contextual factors are really muddled, particularly if you have a country that's so diverse.
Yeah, I mean, there's so much.
So I have to go, apologies, but it's a really interesting discussion. Yeah,
thank you. We do have to finish soon. Thanks, Andrew. Yeah, I'm certainly not a quantitative person, but I do think that the context for, police action is really important. So maybe given the fact that we are quite a way through the project, the quantitative stuff might have to wait for another time, but I think we can move forward on some of the contextual and analytical stuff to see how we can progress it. And thanks, Monique. I might look up David Bailey's work about direct and indirect performance indicators. That sounds like it'd be very useful. So we are have reached the end of our time. So I will open it up for any other comments, but we're happy to have more ideas and input emailed to us, to Munya or me or Nick. And yeah, it's been fantastic. And I think this has been really useful to think about how we can move forward to the analysis phase. So Andrew has just written something. Possible to do some of what? Right. Okay. I'm not familiar with the Afrobarometer stuff, so that would be, yeah, we'll have to look into that. But would anyone like to make any final comments? Alki. Oh.
I'm sorry if I speak too much. I was just thinking, if we
So this is the project that the broader project looks at the different regions, right? So that could, and I know all the regions are very diverse in themselves, right? But that could be a first perspective on comparing, for example, what is happening in Africa with what is happening in Latin America or the US or in Europe. And this is very broad, obviously, and not quantitative, but that could be interesting. Just a thought.
Yeah, no, I agree. And it's interesting, like having a bit of an overview of all of the regions. When we were talking before about political interference, it struck me, like listening to Michelle McManus talk about and others talk about the change in police accepting sort of public health approaches, and that's driven and invested in by the Home Office. But so you think that there's progress that may not be reversible, but then I saw something in the paper about Boris Johnson announcing last week something about, I don't know, something bizarre. And it's like, well, it's politics has just a different mind of its own it's not helpful sometimes, but maybe I don't know enough about that to talk about it. But yeah, but thank you. Munya, did you have anything that you wanted to add before we wrap up?
Yes, to just say for everyone who is in the group or in the meeting, if there are any more case studies that you think we should document, please send them to either myself, Nick, or Melissa. And I think thank you for all the comments and some of the new suggestions, and also to just say this project was about documenting case studies, and we really take it that I think some other suggestions that have come up here are worth pursuing. Thank you.
Yeah, great. No, we've certainly got more things to think about, and yeah, I think we have got some funding to have a final phase to wrap things up, but it still is, I think we've got lots of ideas for another project, yeah, which we look forward to, and look forward to you joining us. So thanks so much, and we look forward to engaging with you again soon. So good night, good day, good morning, wherever you are.
Bye. Thank you, everyone.
Thank you. Bye.
Bye-bye. Thank you.